Hey everyone, welcome back. Today we're going to talk about the 5 things you need to know about age-related macular degeneration. First off, number 1, what is age-related macular degeneration? With any medical term, I always like breaking it up into the words. Age-related implies that something is going to get worse as you get older. Macula is the area within the retina, and degeneration implies that something's being broken down. So what happens in age-related macular degeneration? In AMD, you lose your central vision. That means you lose the ability to see fine details important for things like reading, recognizing faces. Your peripheral vision remains intact. This is actually one of the world's leading causes of blindness in the US and in the world. So what is the difference between dry and wet AMD? In dry AMD, which is the most common form, there is no new blood vessels. In dry AMD, instead what you have is a collection of proteins called drusen that build up in the back of the retina. This can still cause central vision loss. In contrast, there's wet AMD. And in wet AMD, there is new blood vessels that can leak in the back of the eye. This is by far the worst form. What are the risk factors of age-related macular degeneration? There are several. Number 1, getting older. Number 2, having a family history. Number 3, being of Caucasian descent. Just because you have all those risk factors does not mean that you'll get AMD. Risk factors are just that. They increase the likelihood of you getting the disease, but it does not mean that you will get it. So how do we treat AMD? The treatment of AMD depends on whether or not it's the dry or the wet type. And in dry AMD, what I recommend is 2 things for all my patients. Number 1, I recommend avoiding smoking, and this also includes secondhand smoke. And I also recommend taking these eye vitamins called the ARED vitamins. The AREDs contain vitamin C, E, lutein, and zeaxanthin, and they are essential at preventing the progression of AMD. In contrast, in wet AMD, there are new leaking blood vessels, so medications are injected into the eye to stop the leaking blood vessels. AMD is a very serious eye condition, and one of the key things is early detection so we can provide prompt treatment. This is why I always recommend an annual eye exam for all of my patients. Remember, as always, your eyes tell. Thanks for watching. We'll see you next time.